Hello, and welcome to the Jobst Compression Institute. Today we're going to discuss measuring for an Elvarex thigh-high garment. Our tools for the lower extremity include the prescription order form, the lower extremity form, a measuring tape, and a marking pen. This is our patient Beverly. We have our patient sitting on the table with her legs extended. Beverly is a primary lymphedema patient with swelling in both legs. We're going to start our measuring at our A measurement. The A measurement is at the metatarsal heads. I'm going to take my tape measure and come around without any tension in the tape and take that measurement. Next, I'm going to move to the Y measurement. The Y measurement is at the heel, coming around the tendons at the bend of the ankle. If there's swelling present, we're going to take that tape and create a little X to take a little bit of that swelling in so we're not too tight. As we move up the leg, the B measurement, which is our next landmark, is right above the ankle bone. Beverly has a little swelling in her ankle, so we're going to pull that tape a little bit, put a little tension in there, and then I'm going to mark that spot. Next, we're moving up to the B1. The B1 measurement is at the base of the calf muscle. We're going to take this measurement, we're going to put a little tension in the tape by pulling on both sides of the tape. Then I'm going to mark my spot here. Next, I'm going to move up to the C measurement. The C measurement is at the full part of the calf. This measurement, we also want to put some tension in the tape. I'm going to pull on both sides of the tape, pulling, take my circumference, and then mark my spot for my length. The next measurement is the D, which is about 2 fingers down from the bend or right at the head of the tibia. Come up here. And we're going to take that D measurement without any tension in the tape. You can see I pull and then I relax the tape a little bit. And I'm going to mark my spot there. On Beverly, if I were doing just a knee high, I would do a slant top. But Beverly, we need to put her in a thigh high. So we're going to have her bend up her legs slightly for the E measurement, which is our next landmark. Traditionally, this is right over the center of the patella, but for Beverly, we're going to come a little proximal. I'm going to move my tape a little closer to her body, and then I'm going to take that without any tension in the tape. This mark is still right at the center of the patella though. We want that, and we're going to take that with a straight leg. You can straighten back up, thank you. Then we're going to move up to the F measurement. So the F measurement is in the center of the thigh. We're going to come up to the center, thank you, and we're going to put a little tension in that tape. Once again, pulling on both sides, and then I'm going to mark my spot for my length. For ease, you may want to have your patient stand during this time. Just for purposes today, we're going to keep Beverly on the table. And we're going to move up and take that G circumference. So the G circumference is right below the gluteal fold at the wide part of the thigh. This is a little easier when the patient is standing. So normally I would take my tape all the way up, and then I would take my lengths from the back, from the posterior. For today, we're just going to mark, and the G would be right about where we want to end that thigh high. So, sorry, we're going to come up thank you. That's perfect. I'm just going to move Beverly's pants a little, and that would probably be approximately up there. Okay. So once we move on to getting the lengths, if you are using the measuring board, we can take our tape. Once we do that, we can just pull the tape and take a length measurement at each one of these landmarks. As always, you do want to take these lengths in a linear fashion not following the contour of the leg. So I'm going to come up, I'm going to take my length at B, B1, C, D, the E measurement, which again is the center of the patella, my F, and my G, where I'm going to end my thigh high. There's no need to make any changes to the length of the garment by adding silicone bands. Those calculations are done in manufacturing. If I add a 5 centimeter or 2.5, they'll add that on automatically. Do not add zippers to the garments unless absolutely necessary. These create pressure areas and reduce the stretch of the garment. In all flat knit garments, choose an appropriate compression to control the patient's swelling. Keep in mind that flat knit garments provide more containment at lower compressions due to the stiffness factor of the garment. You cannot compare a flat knit garment to a circular knit garment. As always, if you have any questions, you can call our Elvarex team, your medical education advisor, or your local JOPS representative. We fit our patients for life and take pride in producing a custom-made garment that's unique to each individual. Thank you.